okay?
Please send it to me later.
Down here, it's gonna say return. The return button is what locks this bed. The one beside it says break unlock, that's gonna unlock it. So right now, it should be locked. It's locked. Now then, when you guys start, I'm gonna have y'all do reverse Trendelenburg. Each one of you will do something different. Tilt
So
left,
this
tilt
is a
right,
safety strap.
okay?
Remember that
So,
goes on every patient.
Let's say
We're now on
the
operating bed, okay?
surgeon wanted the head over
So
there.
there's gonna be different safety. You're gonna have
Okay,
some
on
like
this
that, and you have
particular
some like this.
bed,
Okay,
You look down,
so this is like a seat
you
belt.
look down here,
Lift it up,
and y'all have to come
pull it
around
out.
and kind of look down here, you see this? Okay, we're gonna turn it.
Just taking it out, okay? So we're gonna show you the bed.
So
Okay,
I loosened it,
now, there's different beds with different, like, look at that one. That one's different than this one.
your preference card,
Okay.
your preference
Can you
card
put that
should
up there
tell
on
you
the,
how
on the
to
back
use
table,
this.
please? Thank
This
you.
particular bed, the sky
So,
one,
this
you
bed
can turn that lever. Now,
has
once you have
on,
turned that
off,
lever,
lock,
please,
floor
please,
lock,
please,
unlock,
come back over
It has
here and
normal,
tighten this back up.
reverse,
Otherwise, the patient's
Trendelenburg,
gonna keep
where the head is
swinging,
down.
and if you bump them,
reverse
Okay.
Trendelenburg,
So we
where the
would lock
feet
it back
is
up.
down, where you're bringing the feet further down. The height up, that means the bed is
Okay.
raised, and then it's lowered. The tilt
if
is
he wants
tilting
it
to
at
the left or the
opposite
right.
end,
The back
and we've
up
already
and the
got
back
patient
down.
right down,
It's the back right here. The
that's
legs
when
up,
the
legs down,
anesthesiologist
right
will be
here.
doing all
And the
turning.
flex,
Okay?
for certain cases, you'll flex the bed. I very seldom seen that. And level the bed means it's
We
the
gotta
level.
intubate first,
It's level,
right?
okay?
So
All
once
right.
he intubates,
So-
then the anesthesiologist will be the one that turns the bed.
Always,
Okay?
if you helping your nurse out, or if you're in the room and they're bringing a patient in and they're about to transfer him to the OR bed, if your nurse hasn't checked the OR bed, just check it, just move it to see if it moves. If it moves, hurry up and lock it, because you don't want, they're gonna lock their gurney before the patient moves, or we move the patient, they're gonna lock their side, and you're gonna make sure this side is locked.
These,
Because you don't want to start moving the patient, and this bed is not locked, or that bed, because the patient's gonna fall. And nobody wants that, okay? So just always just with your hip, if it moves, okay.
Would you
You
be
know what to
sterile
do.
at that point though?
No, I'm just saying, no. You, that's a good question, but no, we're not gonna be sterile. I'm just saying, like, you already set up your back table, you already set up.
pull
9
it,
times out of 10, you're
it
gonna
makes
set up
you able
before
to turn this.
they bring the patient in the room. Now, if it's a
When you're
rush
putting the
and they
arm
bring the
hold
patient in
on,
the room and you still setting up, that's okay.
Okay.
this
You can't go
lever,
over there and help her at that
here,
time because you're setting up and
you
you're
hold
stirring.
that back to put
But
it on
in the
bed.
case where you've already set up and you just waiting for them, you can go ahead and break scrub. Make sure you put on your what first?
Non-sterile gloves.
Non-sterile gloves, and then you will, help her with the patient. You may be at the feet, holding them, moving them over, or whatever, okay? So, at that time, yeah, you can touch the bed or whatever, okay? That's a good question though. So this is on, so the bed is locked, so if I wanna unlock the bed,
Okay?
where it says floor lock, I gotta hit that curve. Because if I just hit unlock the bed right now, it's not gonna unlock.
Okay?
I'm pushing unlock, it's not. So hit floor lock again, that's gonna light
So
up
if you just
a
do it like
green.
this, you never
Then
get
hit
it on.
unlock,
Now
and
lift
it should
up,
rock a little, you'll hear it.
Okay? Straight up, straight down. Now
With
then,
that one, it'll rock, but it's unlocked right now. So if you move, you do this, it's moving, okay? To lock it back, do the same thing. I can't hit lock, it's not gonna lock. Hit floor lock, and then lock. And
You may
hold
use
it
a
down
blanket,
until
or
it
you
locks.
may use an egg crate. Today, we're gonna use an egg crate.
And it'll
All we're
stop.
gonna do is
So
make
I'm moving,
sure-
I'm doing that, it's not moving,
So,
okay? So
if I'm way down here,
bring,
and I'm trying to put his arm here, what's
so
gonna
if
happen?
you wanna move the bed, Trendelenburg, you hit Trendelenburg,
What
okay?
can happen?
The bed is locked, so if See, it's moving.
We always wanna make sure, cause everybody
Cool.
is built differently.
Oh.
That whenever I move this,
Oh,
it's in a perfect alignment, okay? And when you move the arm,
that's just
grab the
this
elbow,
part of the bed,
and the
it
wrist.
does that. Sometimes
Cause
it
we
pops.
don't want a
Now,
lot of
reverse
pressure on.
Trendelenburg is that way. Now, in some cases, they may have you go really straight up, you'll have a foot board down here, so the patient won't slide out. But always, the patient is gonna be strapped in.
Sometimes it'll be where it's.
So remember that.
It's hanging down like this,
I'm moving it, but the patient is always strapped in, okay?
and that's when you're going to
So-
fold this. Okay?
So
Give that
I'm
wrist
hitting
support.
level, right here, there at the bottom, and it's leveling the patient back out straight again. You see? All right, give me that belt, cause I want to practice the way you
And
should.
you just wanna do it over the forearm. You don't have to tuck all
So can you
this.
tuck
Just
this
get
part
fold it over.
in between one of these little things right here? Press a little bit right down here. Just bring that down and in, and then bring it up.
Okay, I don't put it over the wrist, and I don't put it over, I always make sure I'm over them, okay? So this is how we do this, right?
And it should always be
I'm
on
gonna
their
go to the other
thighs.
side. I'm just gonna put the
You
arm
can bring it a
on
little
the
bit
other side.
further up,
Okay,
about
I'm
right
not gonna
here.
pull their arm
Yeah,
out.
and then put it
We
in
got
like you
this
putting
arm
the
out
seatbelt
because
on.
Anesthesia needs to get to this IV that's over here. And we're gonna turn the bed this way.
Then pull it snug, not too snug, cause you don't want
Same
no
thing.
pressure sore or
And sometimes
anything
you
in
have
there,
to
okay?
Get your
All
nerves,
right, so
depending on the patient's
we're gonna do
size.
Trendelenburg again. So the patient's not gonna really
got it,
slide out.
thank
The
you.
head may slide forward.
You're gonna pull
If they
that
do in the
lever
case,
back.
they're gonna have something here to keep the hair from
I'm going
sliding.
to straighten it.
Down here, you're moving it.
I'm gonna go
Reverse
up.
Trendelenburg
Now making sure I'm in between the
here.
two bars.
Remember, Trendelenburg
And down.
is where the head is going down. Reverse Trendelenburg is where the feet is going down, okay? All right, so I'm bringing it back to level. So we're good there. Now, to raise the bed, the whole bed up, you're here to make it tight up, going
And then
up.
of course, same thing, you would put a strap on.
And the surgeon may say, can you lower the bed?
Down
You won't ever do
If I'm
this,
doing an
it's gonna be
abdominal
anesthesia
surgery,
doing it.
I wanna
Cause the
put this
anesthesia
over
will have the
legs,
controls
right?
here.
'Cause we can't have
No
that
sterile
here.
person is gonna do
Okay.
this.
So,
But we're just showing you how to operate the bed, just in case you're
always
non-sterile
feel for their needs.
and you helping the
Never
nurse out.
put this over their
And you know there's gonna be certain things, maybe you can raise or lower the bed some. Or if they bringing the patient in and they're trying to transfer the patient
Never
over,
always over.
you can grab
alone.
this right
Never
here,
over.
because anesthesia is gonna be helping her
Because
up
let's
there.
just say.
And then they may say,
this
lower the bed
patient
some, so you already
doesn't
know.
do well under
Just push that
anesthesia,
bitch,
and
lower
you're
the
gonna meet a
bed
lot of
some.
those.
Just
They do
something
not
simple,
know.
okay?
Remember this. They
Now,
have
tilt it to the
no
left, you may
clue
say,
or
can you
memory
tilt
of
it to
what
the
they've
left?
done.
Bed's
Never
gonna
get
tilt
mad
to the
at them,
left.
'cause they're unaware.
But the patient is
But
always
let's
gonna
say
be
he's
strapped
waking
in,
up
okay?
And he comes up swinging.
Then tilt it to the right.
And he's angry. Well, if I
I'm
have
looking
this
at time,
over
make
his
sure I tell you,
knees,
show you guys
and
lunch,
he
right?
swings and falls, what's gonna happen?
I'm hitting level again to go back, okay?
It's gonna break both of his legs.
All right, the back up,
So not the shanks of either?
No. Do you know how easy this would be to come out from under?
back down,
All he's gotta do is bend his leg,
Leg up.
because it's under his knee. So if he bends his
Okay.
leg, it's
Leg
gonna come
down.
out. So always over
and
the
the flex
thigh.
means it's gonna flex
above
right
the
here,
knee.
where the back
Okay.
is,
So
it's
then,
bending it,
we get this belt,
and
that
then
same bar,
back up,
we're gonna put it inside that bar, and we're gonna slide it down,
okay?
okay?
So I leveled it
And I'm gonna
back.
come over there and
So
do that side too.
that's how you operate the bed now, and each of you gonna get the practice.
This and
Next
Lift
thing,
this up,
so, let me
Unless
see
you're
what I
scrubbed
wanna
in.
do first.
okay?
We're
Now,
gonna
if
go
you're
over the
scrubbed in,
arm
your nurse
boards.
says, hey, I need your help.
So the arm boards,
Okay?
sometimes the padding may be
You
thicker,
don't want it
like this
tight,
one.
You don't wanna cut their circulation
See how
off,
thick
you
this
want
pad
it-
is versus this
Okay?
one?
And always make sure that there's
So-
something between them and the belt.
You see this part
Whether
here?
it's a blanket.
You put your
yes,
finger
ma'am.
on,
Anything over here?
right here. It's like a little
See the graphic
toggle
here?
switch. You're gonna make sure this is down,
I've got a bar here and a bar
and
here.
you're gonna make sure
How
this,
about if I do it right here?
this is moving it. You see how it's moving it?
Where the gap is. So you need to be
So I'm always making sure it's right there. Okay,
I'm still
So,
gonna check,
you wanna come over here?
make sure they're not in my area.
So, this part here, you lift it right here,
Slide it in.
and you're gonna tilt it down like this. So this part right here, this little hook thing, you see how it's got a little hook? It's gonna seat right there, okay? So you're gonna tilt it,
Okay, so today.
and you'll hear it, and then you're gonna let it go. So it's in place. Here, if you wanna say the patient's
And it'll
arm,
take you 10 minutes to get it on.
cause they may have IVs or
Because
something,
it's just
you
hard.
putting the,
You've got a body here.
his arm is not that
and
flexible. Say I
the
wanna
mattress is being
make sure
pushed
his arm
out,
is laying
what's
on it.
underneath them, the padding, and you can't even see
cool.
this, and it's hard.
And usually you have a
And that's
pad
when
under
you get
here,
your nurse to
cause you
kinda
don't
help
want
about
pressure
pulling the
sores
patient over,
on
where
the
you can
ulnar
see
or
it.
anything like that,
Um,
okay?
I have a quick question.
Yes.
So, you said
That-
you won't obviously be doing this when the.
So you see how that
restructuring,
is? So it's
technically in a
on-
real
it's
setting,
on the
when would
cushion.
this happen?
And then you will secure this, just like you secured the patient to the
that's
bed.
it.
Okay.
Now, there's been a time. that
Because
I
you
have-
don't want them moving the bed up or down and then the patient's arm fall off or get caught in something. So that's why we secure it, okay?
I stay
So
in the
that's it
OR,
on that one.
but I break scrub. And then when they come in, I'm free,
Marissa,
okay?
get the other arm board and put it on for me.
And so I help, I stand on that side because the patient's wheeled in on this side. So I stand on that side, so when they are moving themselves over, I know they're not gonna go too
Very
far.
good.
Just like if you're scrubbed in
Very good.
and the
Make sure you're
patient's
seeing what
moving
you're doing.
over, you can walk, this is my sterile field.
Make sure you hold
You
it,
can
hold
walk
it down
up
there
and none
on the
of this
back.
is sterile.
Yeah, so
Okay.
you can just, so you have
Put your
control
back
over it.
against it, cause your back's not sterile, right? And then you don't have to worry about the patient.
Is it
Yeah,
Going
like
on the
this?
floor.
yes, very good. No,
Because
no,
they're
no,
gonna
no.
hit your
Oh.
back,
Just this top part, not the bottom.
okay?
Just
Now,
this
if
top
they
part?
grab
This
your
part right
waist,
here.
okay?
you know,
You're doing it at an
As
angle.
long as it's not
Go
in
at
that
an angle,
sterile area,
and then
you're
come down.
okay.
Um,
I've had an elderly person, grab my waist.
There you go. Now
as a
move that.
leverage to help them pull
Yeah, pull
themselves
that
over.
little thing towards you.
But
It's a little hook thing.
typically,
Now
I keep my
move
hands
it
right
from side
here,
to side.
I don't turn around, I
Okay?
don't help them, but this
I don't know, we don't have another,
keeping them from going too far.
cushion here.
So you
Just
can do
grab
this,
this one right now.
okay?
When you say break scrub,
Mhm.
are you saying like take
So,
off your scrub?
and his
Uh-huh.
arm,
Break scrub means break scrub.
right here.
Okay,
Right now.
so then once we,
Very
if we
good.
break
Now
scrub,
put the safe
we
strap
have to go
on.
through the whole scrubbing process again, or no?
Oh, wait, so is it up here
You
that I want it?
use the apple
Never
bottom
on the wrist or?
Yeah, it can be down there at the wrist.
Okay.
Yeah,
And you're going to,
okay?
you're getting a bunch
Now,
of it.
to take,
And you're gonna be
to
so
take it
okay,
off,
Okay?
And then we.
take this out and this. And you can move the patient's arm right by their side. To take it off, you just grabbing this part. Well, first I'm gonna move it so it'll be easier for me to take it out. And that little toggle switch that you use to put it on, you're gonna pull that and pull it up and out. Okay? So do you wanna do that? So you can get your pants on, you've already done that.
Okay, so I'm glad I told y'all that.
Put the
I felt
patient on, make
relief
sure the patient
on the
arm
faces.
is not on it while you're
So
doing
yeah,
it.
your first morning scrub.
Okay, so
Now
that's
hit that
fine.
toggle switch,
Why would
yeah,
we break scrub?
move it
We
right.
should do that
Now that little toggle switch,
I
it's sort of tilted up
Yeah, I was
and
like, I'm
out.
not breaking scrub then.
Just lift it up.
So
You got practice, cool. Now put it back on,
If the nurse asks you
get
for
that little,
help,
yeah,
uh,
go at an angle.
So you take it off, you put on
See what you,
sterile,
very good. So,
Before you
You've
come over
already
here to
practiced
help,
this, okay?
Absolutely.
so
and then you can use that.
everybody else,
Because sometimes they give them that happy drug, right?
let's practice on board.
And-
So